Yes, it was my idea. I had friends that had this type of surgery, the LASIK surgery, before, and family as well. Great experience for them, always hearing about how they went to sleep, woke up, and could see perfectly. And I thought, yeah, okay. I've been in contacts, just like Kelly was saying, I've been in contacts since I was 13. So it was a really long time. And so I started looking into where we needed to go, what we needed to do. I've had friends that have gone elsewhere than Dr. Wang and regretted that decision because they just heard about the experience that they'd received from that Dr. Wang has given others, and it was not the same elsewhere. So for me, I thought, well, I want to go where the best is, and consensus among my friends and family was to Dr. Wang and the Wang Vision Institute. So we started looking at options and what we could do just at this point in our lives, and I said, well, I don't want to go by myself. I don't want you not to have correction and me to have correction, because we every night take our contacts out at the same time, every morning, put them back in. And so I didn't think that was fair necessarily for one to go first. And so we decided to come together. We actually came on a Monday and had the surgery on a Friday that very same week. Travis went in first, and then I went in second within about 12 minutes apart. And we left together with my mother-in-law driving us home. And that evening we listened to a movie because we had our protective sunglasses on, and we were dropping drops into our eyes every second, it felt like. But just because I wanted to, not because I had to. I think it was every 15 minutes at first. And we woke up the next day and were able to see and had that magical experience that people had talked about, where you just open your eyes and there's everything you used to have to reach to get your glasses for. So how did we decide to do it together, since I coaxed you into this?
Why not? Just it's easier to do it. We all have to kind of go through the same regimen afterwards together, and it's just easier to do that. But before she was talking about not being able to see, but I never really knew that I was 2400. That's pretty bad. All I knew is that I couldn't see my alarm clock, which was about 2 feet from my face. But it's great. The first day and every day since, you kind of wake up in the middle of the night instead of leaning over to see what time it is. I can tell it's 4 o'clock in the morning and it's time to go back to sleep. So.
Yeah, it's true. We still have times where we wake up or we're about to go to bed, I guess is kind of the thing. We're used to decide if we were going to watch TV and take the contacts out and sit in our glasses, give your eyes a rest, and now they're already out. But we still seem to consider that because it feels like yeah, it's amazing because you've been in that same routine for so long, and it's a really good routine to break. So. Yeah. We were very happy with our decision. We were excited to come back to see Dr. Wang, so it's good to see you.
Did you wake up and think, oh no, that's what you look like in the morning?
I sure hope not.
No, I didn't.
But it is, it's something that you just, if you haven't been seeing for so long without any assistance, you can't believe it. And you think, okay, well, this must be, just because it's 12 hours after my surgery, it's probably going to adjust, and then we'll see what we're dealing with, in a few days. Nope, it stayed the exact same, and it's wonderful.
And, I wore contacts for 20 years, and I've always hated wearing glasses. The worst part of the whole thing for me was having to wear glasses for 3 full days beforehand and nonstop, and I was just dreading, like, oh no, if I don't get this done on Friday, I have to wear these stupid things for another week at least, or maybe 2. So it's fantastic to not have to worry about those things. Yes. So. And my contacts I wore them fine, but they dry up, they'd cause problems. I'd be at work, and then one of them would just jump out of my eye, and that was never a good thing. So it's nice to not have to deal with that, especially if I ride motorcycles, and that's that would be very dangerous if that were to happen while
Well, and actually, it's interesting. Since the surgery, he's obviously very mechanical. When I mentioned the motorcycle, he's taken up flying lessons. So
And I have no restrictions.
he has no restrictions, and
medical
he's flying
That's nice.
planes. So
Yeah,
Did you have any side effects?
none at all.
yeah,
Headaches or anything like
no. At first, you think it's kind of odd to put drops in your eye all the time. And then really your eye guides you. You want to put drops when it says, oh, I need them. Okay. I thought, how am I going to fit all these drops during the day? It was fine.
Yeah, for me,
Felt
that,
good, actually.
For several weeks afterwards, your eyes kind of feel a little dry. About this, we had it 4 weeks ago.
Mm-hmm.
About 1 week
Yeah.
ago, that dry feeling just dropped right off. So I still use the drops just to try to do it, and I have another contact in right now for a few more weeks, so I'll use those drops. But my eyes feel totally normal now. No scratchiness, all that stuff is just gone. So.
He was better at the drops than I was. Just admit that. I did the best I could.
Do you have any irritation like right after the surgery, the same day?
It's a little scratchy. It kind of feels like you have, maybe there's not as bad as an eyelash or anything. It's a little scratchiness, but then that's pretty much gone. And then,
Like the next morning, or how?
Yeah, really just a couple of days. Just randomly I would notice something, but
Yeah.
it was very random, and like I said, about a week ago, every slight little bit just fell right off. So.
Yeah, I think everybody, like medical procedures, like everybody deals with them a little bit differently. I didn't have any of the sandy feeling. I was interested to see how that felt, and I never got it. So I felt like if I put a contact in my eye and there was like a tear in it, a tiny tear, if anybody's ever felt that before, that's what it felt like for about a day after for me, and
That's a
then
better description.
it went away. Yeah, we talked about how that's the good thing about doing it with somebody else is you are always like, are you feeling this, or how are you doing? Nobody else wants to talk about your eye drops, unfortunately, but he did, so so we did. So,
Any other questions?
it was good.
All right.
Thank you very much.
Thank you.
Very good.